Welcome to Pharmacy Prep. My name is Misbah Biabani. I'm instructor and director here at Pharmacy Prep. Today I'd like to present you a study plan for pharmacist qualifying MCQ exams preparation courses offered here at our Pharmacy Prep. After listening this study plan, if you have any questions, please do feel free to contact us at our website, that is pharmacyprep.com. Also, you can text us at our phone, that is 416-223-7737. Also, you can call on the same number. I repeat again, that is 416-223-7737. Thank you. Welcome to Pharmacy Prep. Here I like to present study plan for pharmacist qualifying MCQ or multiple choice question preparation course. This is the best preparation course for pharmacist qualifying exams preparation and offered here at Pharmacy Prep. So this study plan I like to break down into the four sections about the course books that is offered here in the Pharmacy Prep course, and then weekly live lectures, and then question bank, and then mock exams. So I like to go over each one section of this part of this course for those parts in details, and that also gives you idea how this course helps you to successfully pass your exams. So the first I like to go over on the study plan. The study plan means basically we have a set fixed study plan for this exam preparation. Here I like to show you study plan in our um, online portal for exam preparation. So you can access the study plan by logging into this course. So once you log into this course here, you will find a study plan. So for example, here I like to present you one sample study plan for the November year 2020 exams that we have done this one. So if you click on this one, here you will find the study plan. So in the study plan, basically you get complete agenda. Agenda has all the topics that will be lectured on the preparation course. So those are weekly basis, and what topics will happen, that is presented here in the agenda. So you can find the complete topic details throughout for all preparation course. And then also you can click on those agenda weekly basis. So weekly basis, what topic will be lectured, and that will be presented here in the study plan. So every week, for example, week 1, these are the topics that will be lectured, and that based on those topics there will be a practice questions and also simulated mock exams on those. So therefore, there are total 12 weeks course. In this 12 weeks course, weekly basis, what topic will be taught will be presented here in the study plan. So also right after this, each week there are practice tests that has happened right onto this topic that has been lectured on this week. Also linked here, students can access those test questions and practice of them. So just I like to click and show you some of the examples of those. For example, here, let me zoom it up. So these are the test, simulated test mark 1, test questions, all those are linked here. So students can look into those and practice that one. And also right after this week, the lectures that happen, they're lecture multimedia or recorded lectures of those videos also present here. So students can follow them later on their convenience timings. So this is part of the study plan that I was referring to for this course. So also mainly this study plan includes the weekly basis topics and also the questions and answers and mock exams that will be practiced in the class. And now let me talk about the most important thing is in this course, you all students also will be given a books and those books consist of all the syllabus. So here I like to go over a qualifying review book. In the qualifying review books, if I here, this is the cover page for the qualifying review book. And in this qualifying review book, basically we'll be using this book for lectures. When there's online lectures running, students can follow those lectures, and on those books they can highlight them, and then they can mark on those important points that are important for every student to must read for the exam. So just like to give you some little bit more detail what is exactly this review book consists of. So this qualifying pharmacy review book for a multiple choice question exam or MCQ exams that are conducted by pharmacy examination boards. So this is just example content for the year 21 exams. So here basically this review book consists of nearly 150 chapters, and each all those chapters are divided based on their competencies. Competencies are standards of pharmacy practice that is recommended by the NAPRA. So the NAPRA has developed 9 competencies for pharmacy practice or under the scope of pharmacy practice. So this syllabus here in this book is inspired from NAPRA competencies. So here I can present you, for example, competency 1. Competency 1 is about the professional ethics regulation and pharmacist professional responsibilities. So there are about 10 chapters, and each chapter has details, lectures of those topics, and those are all must read topics. And therefore, if you follow all those topics, most likely it will be covering all the important point that is necessary for every student must read for the exam. So that would be covering on this one. And then followed by this, there are next competency 2, that's the biggest one, that is called patient care. Patient care is about more than 50% of the exam. So that means this is mainly it is a therapeutic section. Mean this is about the patient care or therapeutic. So basically there are nearly 90 chapters based on this competency. So it begins from chapter 11 all the way to all the diseases and all the treatments of therapeutics up to chapter 93 is part of the patient care process. So the patient care process is the most important component of the exam. Therefore, we spend more time on developing very good knowledge and also good skills how to answer multiple choice questions cases within the given time. Because the most important thing in the exam is when you go to the actual exam, the one thing you've realized, the time management becomes very essential. So therefore, during this, while learning this therapeutics and patient care process, also we learn how can we do those questions and answers within a minute with the given case scenarios. So this is a part of this patient care, and then comes to the next competency that is called managing drug distribution, also known as product distribution. And this product distribution is about the all the related to calculations, and also hospital pharmacy practice drug distribution is part of the managing drug distribution section. So this is the second biggest competency that is tested in the exam. So therefore, there are pretty good number of chapters and questions given here from chapter 94 to chapter 106 that is given in the review book will cover all the essential things that every student must do for the exam. And then comes to the practice setting, which is a community pharmacy practice setting, which is pharmacy management, which is another competency that contains chapter 107 till 113. So that is another competency. So like this, there are other competencies: health promotion, knowledge and research application, and then followed by communication and education, intra and interprofessional collaboration, And then final last competency, competency 9, that is the quality and patient safety. So those are the components that are a part of this course that is covered in the class lectures and covered in the class books. So from each chapter here, there are essential key points that every student must know is covered in this one. And I like to give you one simple sample chapter, how this chapter will be covered. For example, here in diabetic chapter, like for example, there's a subtitle. Each chapter, within each chapter, you have a four more subtitles, which is a, like for example, in diabetic chapter, you have a diabetic chronic complication. So what are those complications, such as it divided based on macrovascular and macrovascular complications, such as micro include retinopathy, nephropathies, and neuropathies are micro complication, whereas macro are related to cardiovascular, MI, heart failure, and diabetic foot infections. Those are, so how to manage them and what are the clinical guidelines recommended now for to reduce the chronic renal disease risk complication that comes with the diabetes. Means what are those drugs that has been evidence, clinical evidence that reduce the mortality and also morbidities in diabetic patients. So that means we will be connecting in during this lecture based on the current guidelines, recent guidelines within a couple of years, within past 2 years, what are the new guidelines have been given, and all those chapters will be discussed based on the current guidelines, and always they are up to date as per the current guidelines. So therefore, this information that is given in this class book is continuously updated, and that is very relevant for your exams. So this was information about the books. So next, another very important component of our class preparations are the live lectures. What did that mean, live lectures? So live lectures are, you can say it is in here, this slide tells you about the live lectures. So the weekly students will have a live lectures. That means there are two options student can select from. One is in-class lectures, means students can come to our campus locations and then participate in the classes. And then all this is the in-class courses that happens mainly in our campus location. Our campus is currently located in Ontario, Toronto, Mississauga, Brampton locations, so students can physically can come to the class, can have a live interaction with our teachers, our professors. So that's one option. The same live lectures, in-class lectures, also relate online. Those are called online classes. Mean they are live online classes where um, that is same time when the in-class lecture happens, same time online lectures also take. Students can log in and can see the lectures and can experience same experience. Our aim, we promise that to our online students that even you do the classes online from your home or whatever city you're in, we promise that uh, the um, the quality of education online is as good as the in-class experience. That means we promise that online we will provide them in-class experience. So what happens in the online live lectures? In online live lectures, student will get to learn, especially all our lectures are driven by the question alerts. That means we select the key points from those um, lectures where the question can come, and that will help you to guide to focus on those points. So that way, if question comes in the exam, you will have a clear understanding, and because that helps you to focus more on that particular point. Because there are so much information one can learn, but what happens is when you go to the exam, if you really don't focus on that specific point, then that can may appear like a very difficult or very different than what exactly question is. So therefore it is very important to have a good focus and attention on the key points that are expected in the exam. And also we do focus on the very important concepts of each lecture. Lectures have several concepts on several topics, so you get to learn. And also there's a discussion, group discussion online. We do have a group discussion, student participate and ask question and clarify their doubts. That is what exactly called group discussion. So basically this is what exactly the live lectures will offer to you. And these live lectures access can be obtained from our students after enrollment. We provide you access to the live lecture that can be seen once you sign up to our technological platform. We have our exam platform. It is proprietary product of Pharmacy Prep, which is called ePrep Station. That means exam prep station. So this prep station provide you all the access in one from one point. So also this give you our proprietary online access to the live lecture. So once you click on this live lecture, you get the calendar, and then you click on those whatever the class you're taking and select those class and select the calendar and click on that link. That means you can access the live lectures from any device, any computer, laptop, or phone, or any smart device that has on internet in it. Gives you access to this one, and all our database and all our lectures and multimedia are very compatible with the mobile devices. So that means you can also access from any device. Great. So now I think by this time I had explained you what a study plan includes, and then what kind of books we provide and what live lecture means. And next I have to discuss more about the QBank, which is a question bank. So let's talk more about the QBank or question bank. So I know as the name itself tells you question bank, that means this is all about the questions and answers. So we also provide you online access that enables you access to our question bank, so that way students can access those questions online from home and also practice them. For example, this is the online access to the students who are enrolled in the course. They get this one, and once you click any competency, here you notice there are Q&A. So that is what exactly chapter wise. So right after each chapter there are Q&As. So if you click on any Q&A, that gives you a access to those questions and answers. And those questions and answers that you will find here, they're very relevant to the exam. For example, once you click the questions and answers for this one, here you have the question or case, and right after this case you just try to answer without looking at your answer, and then once you make up your mind and then click the answer, you will see the answer option answer and also given with the reference on those answers. So all our information is evidence-based information. Every answer is solidified or confirmed with the reference-based information. And also the questions are very relevant to the exam. Our goal is to make sure if you practice pharmacy prep questions, you must pass your exam. That is our goal. That means the question bank has the secret of success. So all our questions are developed by ourselves, our team members, and also our staff. We're very highly professional and dedicated a lot of time on developing these question bank, and also all those questions are answers are supported by evidence-based information. So this is what exactly question bank will give you access. So also in this question bank, you also have all each topic you have Q&A here for related to this topic, and then you also have an option to test yourself. That means you can test questions right after to see how your performance does. So the test yourself will give you additional practice to see how well you're ready for this test. So therefore test yourself is another method to make sure that you do well in your practice. So the ultimate goal is to make you confident on the questions and answers. Because when you go to the actual exam completely depends on multiple choice question. So all questions are multiple choice questions. So therefore, having those mindset is very essential to do well in the multiple choice question. So otherwise, also include question bank, chapter-wise question bank, and also in the class you learn a lot of strategies to solve multiple choice questions, because sometimes students they study too much on some points, or sometimes they study too less on that one, or sometimes they think too much answers and finally they stumble on wrong answer, or sometimes they go for quickly the wrong answer. So there are so many ways, while keeping in mind time management, how well you can do those solving strategies. That means there are lots of clue, like uh, cues are given in the exam. So therefore, there are so many cues in the each question. So in the class, you get to learn how do you look for the cue and how can you answer them within a time of the question in the exam time. And also we will get to know certain point that you need to memorize to answer them, and certain points, certain clue you look for question in the questions and answers. All those are presented in the QBank. Great. So next comes to the also the Q questions and answers also helps you to apply your knowledge to answer multiple choice question, and that is basically helps you to make you very confident on those process. And very high level of thinking, critical thinking to answer case scenarios are very important, because sometimes there are some questions, there are a lot of questions have two answers, uh, looks like a best answer. So choosing one of the best answer takes some lot of thought process. So you weigh in risk, benefits, and also you weigh in what is the best thing decision for this patient. So that kind of critical thinking in the patient care process is very, very vital to answer some questions. So there are always you have um, two best answer or maybe only one best answer, then making up that mind what is the best answer is very essential to develop those critical thinking. The last section of our course that also includes mock exams. Mock exams are simulated exams. That means they are look like a real exam, actual exam, and that is what we call mock exams. That means we have developed a professional software in our online program where students can access to those uh, computer-based tests. For example, here we have a computer-based test. If you click this link on the computer-based test link, you will get into the computer-based questions. So here, and this is designed to simulate like actual exam. So time management and the intensity of questions. So like for example, click on one test and start your time begins for this computer-based test. Here you have a timer, so you have 2 hours time and you got 100 questions. So computer-based testing, it will give you option to play within this 100 question from 1 to 100. So and you have within this time, so you have to be very fast, mean we have to be very time managing skills, and you have to learn how quickly you pick up your answers and find your best answer, and then done, and then exit to the next, go to the next question. Or for some reason, if you are not having a best answer, you're not ready to answer right now, you also have an option called flag option. Flag option means it gives you option to select one option and then leave it, move to the next question. So whenever you come back, you still, when you go to the next question, when you were are marked as a, you mark as flag, I mean this question will change, color is changed. And some programs that are in the test, there are small flag shows up. That means that question has not been submitted yet. Since it is not submitted, then you, before your time is over, you can come back to those questions and submit that one. So unless you submit, then only it consider as that question is done. So therefore, you have to make sure all those questions, whatever you marked as a flag, you should come back to them and submit those answers right away within the time. So this program is developed as exactly as like an actual exam. So therefore, we call them uh, mock exams or simulated exams. So in this one, there are section-wise tests. Each section has a test, and then you will be practicing as time management, and then you get to learn how the computer-based testing is done. And also in the class, we will discuss right after the test. Every week, we will be doing a one test, and after that test, we will be finishing this test. And then we will be having a discussion on why these answers are the better. So these are the basically you get practice lots of tests, and finally you will be ready for your actual exam. So that means all efforts are done to be ready for the actual exam, and then once we have finished this one, we'll be ready for those just before the actual exam. We'll be doing several final mock exams, so that way you have a great practice on them. All right, so hopefully this 5 steps plan that is offered here at our institute